Okay, uh, I think we are live.
Yes, we are.
Okay. So I would just wait for a few seconds so that some people can join us.
Yes, we are.
Okay, so hi, good evening, everyone. Thank you, Farman, for the confirmation. So, guys, today's session is all about the FMG exam and what all we have got for you guys. So, with me today, I have Dr. Rajat with me. So I think we can just put on some important points about your exam and what all we have planned for you if you are looking for a session where you can revise all your content. So hi boss, good evening.
Good evening, boss. How are you? Good evening,
All good,
everyone.
sir. All good.
Yeah. As we all know, that postponed on to the 20th January, it has come as a respite for some of the students. Some people were disappointed; those who were preparing very, very well. But I always believe that everything that is happening for the good. So it's a good thing that you have got some more time, and you will be able to plug some of the gaps that you have in the preparation, and able to reach to that magic figure of 150 plus. Please remember, in FMG screening exam, on the basis of my experience of more than a decade now, I can say that if you remain focused and you identify and you clarify your goal, that you have to get 150 plus, you have to see pass in front of your name, it can be easily done, provided you see all the 19 subjects, not in too much of depth, but a basic aspect of them. So in this session, we're gonna try to talk about those, that how you can effectively utilize your remaining around 50 days, so that if you are thinking that there is some loopholes, you can plug them. Over to you, Dr. Sushil.
Okay. So as Dr. Rajat rightly said, the FMG exam, and I would say rather any of the exam, the foundation of any of the exam is based on the basics and the concepts. And if you see in none of the exam, any high-fi question, high-fi thing has been ever asked, right? So if you want to just go for the 150 plus, just forget the point that I have this much of content in my book. My friend is having that much content. I'll add on that one also. So that's not a good thing to do. So whatever content you have, whatever you have read till now, you have made your own notes. So trust them and trust them completely. Okay. And don't get uh, you can say influenced by anybody's else notes that he has written 10 pages more than me. That's not going to work. What works only is the basic and the concept of any of the subject. So now when the exam has been postponed, like sir already said, there some people were very happy that they've got some more time. Some people who were like almost ready for the exam, they were little annoyed with it. But anyhow, we can't do anything with that. So what best we can do is we can utilize this time duration for the betterment, for whatever was lacking, whatever subject you were weak in, whatever subject you were not able to test, that how you are going to perform over there. I think that is a time we can plan for the things. Okay. So in these last 50 days, I believe first thing that you should focus and you should never miss is always about the previous year questions, which I've been telling all the time to everyone, that previous year questions are very important and they have to be done all the time. You can't afford to miss them. Number one. Number two, when you go to the the notes, you are saying some people said that I'm left with particular subject. Can I go in the exam after leaving a subject? Now this is a golden period for you guys. So whatever subject was like not prepared, you have not gone through it, it is the time you can plan your schedule again and you can just go through it. Okay. So from my side, we got like n number of requests that we want at least something, some schedule to keep all of us on the track. And for the same, me, my team, Dr. Rajat, we have made one schedule for you, and that is about the revision test series for all the FMGs. It's not only for the enrolled student, for everybody, right? And it's free for everyone. There is no charge. Let me clarify this thing. Like many of the people might start thinking that we have come up with another series and that's going to be sold. No, this is absolutely free for all the FMGs across India. So we have got this revision test series for all of you, and we are starting it from tomorrow onwards, the 1st of December, and it will be going till 15th of January. Okay, so all the 19 subjects, they have been covered up in this test series at a particular, prefix time. The schedule has been already like made. It will be shared with you, and I do believe that my team has shared one link with you in the chat box. They'll be sharing it with you. So just fill up that link, and you will be like allotted the complete test series, which will be preparing you for all the subjects. Now, if I just tell you about this test series, no, the first exam that we are having tomorrow, it is about the ENT and the forensic medicine test. Okay. Now, what was our plan? What was our idea behind this? The second test is on 4th, third test is on 7th, fourth test is on 13th. And after these three tests, the first, second, and third test, we have got a grand test also. That will be having your 300 questions, simulating your main exam. Okay. So we are giving you three grand tests. Three tests are there, grand tests are there, 300 questions each. And other than that, we have got the complete test series covering all your subjects. Now, our idea was that one point we wanted you to do is to revise the whole content, right? All the time. So some people who are not good in a particular subject, I would recommend you that you must revise all your content before giving the test. That will give you a proper schedule, that will give you a proper timetable. Whatever subject you are lacking, you can prepare in those 3 days of duration, which is there in the gap, the first test and the second test. That is one thing. Second, if you are confident about your preparation, that I'm okay, I can easily score 150 plus, I've done that much level of preparation, then I would suggest that do not, if you're not willing to give the subject wise test, I would request you and I would suggest you to that you should be a part of the grand test. Grand test will be simulating your main exam. Okay, that was all the idea behind this test series. Now, this test series, yes, it will be conducted on the DBMCI live app. Yes, yeah, it is for FMG. You said it very, very rightly. I'm talking about the FMG exam only, which is now postponed for 20th of January. Okay, so that is how we have planned for it. And I'm sure my team can easily put the schedule in the chat box as well. It will be there in a while in the chat box. And they will be putting one link also in the chat box where you can just click in and put your details, and your eGurukul app will be activated for this particular test series. Okay, so boss, would you like to say something about the test series that we have planned?
No, boss, you continue.
Okay.
And wherever I have to give my opinion, I will add to it.
Sure.
Please continue.
So
but I think
yeah.
sticking to the schedule and writing the test on the time is the single most important point that will take the students to their dream digit score.
Absolutely.
Yeah, please continue.
Yeah. So whole idea was, many of the people, like after postponement of the exam, we got the message, like I personally got number of messages. I'm sure Rajat sir also would have got number of messages. So it was all about that we are not able to make a proper timetable for us. And now as the exam has got postponed, then we are losing the continuity in the studies. We are losing the track of the studies. So that was the whole idea behind bringing this test series for you guys. About the test series, about the schedule, if you ask me, the first test, yes, I said it is about the ENT, forensic medicine, then anatomy, then physiology, then pathology, then pharmacology. So in the sequence of the first and second year, and we got like number of requests about putting the first test as ENT and forensic. So basically, I believe like the ones who requested us, they were not very well versed with the two subjects, ENT and forensic. So that's absolutely fine. That has been kept like that only. So as you go from the preclinical to the paraclinical and then to the clinical subjects, that's how the subjects have been planned. So after every third day, you will have the test. After completion of the test, you will be able to see the complete, the answer with the proper explanation of that particular topic. And this test series will be created keeping in mind that it covers all your previous year MCQs, and it stick to the guidelines of the FMG exam only. Okay, so that is the whole idea. And okay, Link is not there. I'll ask my team to put the link. Don't worry, it will be there in a while. So PYQ kitna help karta hai? See, understand, you have to understand this point. It is not about the PYQ. Previous year questions, the topics are repeated and the question from that particular topic can be asked to you in variable ways. So what we have to focus upon is previous year topics, the question from which the particular topic from where the question has been asked. You should be very, very thorough with it. You should be very, very clear with it. Okay. So if you don't do the previous year question, it will be quite a big possibility that you might miss out most important topics which are frequently asked in the exam. So it is always recommendable now when you got almost 50 days for your preparation. It is highly recommendable that you should go for the previous year topics from all your subjects. And it's not that tough also, right? All the questions, the way in which they are asked, they are the basics and the concepts only. About the link. Okay. So just allow me a moment. Will our plans get extended, which is till 31st of December? Elfaz, if I'm not wrong, Raima, if I'm not wrong, you are already our FMG student, isn't it? So if your plan, if you can revert me back for that. So if you are our existing student and your plan is getting over on 31st of December, for sure, we'll be extending it to 20th of January, not to worry about it. Okay, we'll do that. It's not a problem. So it will be done. Medicine or pharma ko kaise strong kare? See, revision and only revision. That's going to work for us. So medicine and pharma are two subjects, no, where you need to learn again the basics and the concepts. If you learn the basic of a particular disease, the particular pathology, the way in which a drug works, I think the basics and the concepts are the key to anything. So my team has already shared one Google form with you. You all can just fill it over there. And once you fill it, you will be shared the link to join the test series. Okay. So Mohammed Shahzeb, you must revise all your content, the notes that you have made. Please mark the important topics from there and please mark the important previous year questions from there. That will be the most important key that I believe. Okay. So previous year questions, your plan will be extended for sure. Not a problem at all. All the FMG students who are with us, this will be made sure that all your eGurukul plans will be extended till 20th of January. At no extra cost, it will be done complimentary. It will be done automatically. By chance, if somebody's app is not getting extended, do connect with me. You all are connected with me on the Telegram group as well. Not a problem, Elfaz. Not a problem. You have the eGurukul for 1 year. If it is ending on 31st of December, not to worry, it will be automatically extended. It has been already instructed to the team that your eGurukul should not stop. But by chance, if somebody's eGurukul is not working, you can just connect with me. You can just put a message to me. We'll get it done. How much time it will take to complete the neuroanatomy? So if you have already done with the anatomy part, if you are already done, revision must not take more than a half day. I believe about that. So revision should not be taking more time. Okay. And if you are revising it for the very first time, I think nobody teaches neuroanatomy better than Dr. Ashwini, right? Nothing like that. So I would recommend you, if you have not read neuroanatomy, if you have been leaving neuroanatomy for your exams, just try that once. Okay. Try the way Dr. Ashwini teaches and you will be amazed. And I'm sure about it. Okay. So just go for that. Can I do just previous year questions instead of app question also for NEET? See, previous year question, Prajwal, you need to understand. Previous year question doesn't mean a question only. It means a topic as a cell. Okay, let me take an example from orthopedics. If you talk about a trauma, the supracondylar injuries or the neck femur injury, one question may be there from supracondylar, or the Colles fracture, which are very commonly asked fracture, or maybe the external fixators. Question is on the external fixator. But what kind of question? In what way it will be molded in the exam? For that, I need to have the basic and concept clear of the external fixation. Okay, that is the whole idea. So don't just run after that one question which has been asked already. Question itself will not be repeated. There are less chances of that, but yes, the topics are repeated and there is huge possibility for that. Okay, so I would recommend you to just do the topic as a whole instead of doing the PYQs only. Okay, so okay. So my team has already put the message again, the link again, you can fill it and you will be given access to the test series. Right. So in the NEET exam. For the NEET, Anurag will be keeping a session again. Today's session is absolutely about the FMG exam because we have got the postponement of the exam and we need to be with everyone. Okay, so any update about 2 years internship of FMG? Alfaiz, there are too many things which are going on. Right now, there is a notification about the 2-year internship, but it is being challenged in some of the states of India, and people are like very hopeful that they might be able to get it quashed. But let's see, right? So there, until unless there is some concrete final discretion that it is going to happen, or you know, okay. So let's wait for the final notification. As it is out, we'll let you know soon. It is not in the DBMCI app. It will be on the eGurukul app. So just fill the form which is given to you as a link in the chat box, and you will be given access to download the eGurukul app, and you will be given access for the test series as well. Okay. So should we give GT before first revision? Absolutely. See, GT is something which tells you, you know, where you stand right now, where you stand today. So GT has to be given as frequently as you can. Okay. It is not a way to demoralize yourself. It is a way to improvise yourself with every passing GT. Okay. So just giving GT is not the idea. Improvising your GT is the most important thing, right? If you observe, you know, every faculty tells you that first of all, do the Q band and then do the SWT and then do the GT. So basically everybody is telling you that do the whole content, do the most important 100 question and do the most important 10 or 20 question. Okay, that is the whole idea. So GT keeps you sticking to the most important questions of that particular topic all the time. They will keep you on track all the time, right? GT will not allow you to just run away and forget the subject. By the time you are able to revise your first subject, second subject, third, and by the time you reach your fifth subject, you know, the first subject is almost half lost. So GT will be the idea which keeps you on the track, which keeps you in connect with the most important 10 questions of that particular subject. So GT is a must. Okay. Access to eGurukul will be immediate after the form or tomorrow. So it will be, see, test series is starting tomorrow. So your detail, the test will be allotted to you at the preferred time or the prefix time tomorrow. Okay. So let me just confirm this point at what time we are starting the test. Allow me a moment. So I believe we'll be starting at morning 6 if I'm not, just allow me a moment. I'll confirm it. Okay. So okay. So it will be the timing, I believe, is 6 a.m. in the morning, if I'm not wrong. And once you fill the form, no, what time will the test open? What time the test will open? Okay, okay, done. So it basically it will be activated at 12 p.m. in the noon. Okay, so everybody who's filling the form, you'll get the access to the FMG exam, FMG form at 12 p.m. Okay. Access to the eGurukul will be immediate or after the form tomorrow. Access, once you download the eGurukul app, there is a lot more content, you know, to see, other than if you are buying eGurukul, that's separate thing. But if you, even if you don't buy it, there are a lot many things you can see free also on eGurukul. So you must download eGurukul. Okay, so how I study ortho without going into paragraph reading loops, sir, have a hard time to remember all the names, test nerve, etc. So Prajwal, there is one VCC, orthopedics, I believe, is one of the easiest subject, isn't it? And that's a subject I always say which can be concised in some less than 10 pages. So easiest way is take a printout of the skeleton. On one page, take a print of the upper part of the skeleton, upper limb of the skeleton, you can say. And one, you can take the spine, in one, you can take the lower limb. And at every area, keep on marking, for example, humerus. Proximal humerus, just mark axillary nerve. And with the axillary nerve, you know that the nerve, the muscle which will be involved, the sensation where it will be lost. Mark in the shaft of humerus as the radial nerve. Supracondylar, whatever are the important points. So in just one page, you'll be able to concise all the questions of trauma. Okay. On the other page, you can concise all the questions related to spine. On the third page, you can concise all the questions which are related to your lower limb. So 3 pages trauma, 1 page which I always give to all my students. I have given on the Telegram group also, on the Premier group, DBMCI Premier group, on my group. I have already shared that picture. That is about 1 page of the bone tumors. What tumors occurs at what location and what are the special points. So 1 page about the bone tumors. So 4 pages of orthopedics. 5th page can be about the joint disorders. You can just concise it by making some table. What joint is involved, what joint is not involved. 6th page can be about the infections. I don't think infection takes more than a page to understand. Acute, chronic, subacute osteomyelitis, and then you go to the tubercular osteomyelitis, like that. And then the last page can be for some pediatric orthopedics. So some in 7, 8 pages, in fact, less than 10, you can try to concise your orthopedics. Okay. That will not be very, very difficult. So you don't have to go from point A to point Z. Revision means your eyes should be able to catch the most important word that you have written in that line. Okay. When I'm saying supracondylar is the most commonest fracture that occurs in a child, playing child, that is not a question to be asked. No, most commonest type of supracondylar is a type this. That is the most important thing. So when I'm revising, my eyes should be able to catch the most important word that I've written in that line. That is the way to revise. You don't just read everything from top to bottom. No, that is the way you have to do. So I think Prajwal, that will help you out. Rohit, thank you so much for the kind words. For the last minute preparation once, I would recommend you just stay in connect with all the 19 subjects. Number 1, maintain your cool and calm. Don't lose it at any point of time. Whenever you feel like that you don't want to study, please don't study. Okay. With that stress in your mind that I don't want to study, but I have to keep my books open, nothing you will achieve. Okay. So at that time, either you sleep, watch a movie, freshen up, go around, just roam around and come back. Once your mind is ready to study, you have to study. And if you feel like that your mind is not ready to study at any point of time, keep sitting on the chair. Don't move. Keep the books open in front of you. Don't touch the book. Just keep on looking at the book. Don't get up from the chair. Keep sitting. At some point of time, your mind will give away. So sometimes it happens that we don't want to study. So just keep on sitting. Don't get up. So when you don't get up, after some time, when your mind says, okay, now I am tired, I have to study, you will automatically start studying. So sometimes you have to push yourself. Sometimes it has to come from within you that I need to do it. So whatever is the way, the whole point is I have to cross 150 plus, and I will achieve that. You must stick that paste, in front of your wall. Just put a paper, and my target is very clear that I want to see the word pass in front of my name. Okay, that is the whole idea, and I will achieve it at any cost. That is the one thing. Okay, so which GT is other thing I was saying for the lunch. Don't forget to give the GTs. It is very important. It will keep you connected to all the subjects. Third thing, don't forget to do the previous year topics, questions, the topics from which the questions have been asked. That is very, very important. Okay, so just do these 3 things. I think you should be on the track, and do not think about leaving any of the subject. It's not going to work. I can just bet on that. Okay, so which for GT, which is better, previous year paper or other GTs? GT and previous year paper, I think you're getting confused between 2 different entities. Previous year papers are just the mocks of the question that you have got. It is always about, that will be only 1 paper, no? So you should give more number of GTs along with that. Okay. So give GTs like you have got 50 days, no? At least 5 GTs or 6 GTs or 7 GTs is always a good idea. What I personally would recommend you, every 7 days you must have a GT, which we have taken care in the test series that we are launching from tomorrow. For everyone, after every 7 day or 8 day, we have kept 1 GT for you. Okay, so that should be done. About the next is confirmed. So let's talk about next any other time. For small subjects, I have done the express videos for FMG. Okay, so Zain, if you have done the express videos, I think that's a fantastic thing you have done. But now you have got, I believe you might have done that when you were not having time. Okay, so that is my idea. So right now you have a lot of time. So if you want to test whatever subject you have done through the express videos, if you want to check your knowledge about that subject, I would recommend you to give the subject wise test. So when you give the subject wise test, you will come to know the reality, how much you are able to, remember, how much you are able to recall, how much you are able to connect the missing dots. So when a question is there, it's a different way to solve it. And if a theory is there, I just read it by my way, whatever way I want it. Okay. So I would recommend you, if you have done a quack or, a quick kind of question, a crash kind of topic, I would recommend you that you must do the SWTs. And when you do the SWT, you will get the real idea, and then you can improvise yourself. If you feel like any of the subject is weak, you can go for the complete session of that subject, read the notes again, do that SWT again, and improvise yourself. That way you can do it. Okay. Okay, Prajwal, do that, and Prajwal, do get back to me how that idea works for you so that everybody else can do that. And once you make those 10 pages, no, do send me the clicks of those 10 pages. Is LMRP sufficient for short subjects? See, Rishabh, if you are asking me for a beginner, you are just reading the LMRP first time. You have not read the subject A and you are just reading the LMRP. It's not a good idea at all. I'm sorry for being so blunt, but that's truth. LMRP is something which revise your content, but revision means that you have been thorough with that subject already. So if you're not done with the subject, then LMRP will not help you much. Yes, if you are able to recall the points of LMRP, the questions, if they're straightforward, if they're one-liners, then definitely it is going to work for you. But if you ask me, the whole subject will be covered by LMRP without even having the basic idea of the subject, then I am afraid then it won't be that useful. So first get an idea of the subject. You've got a lot of time now. 50 days is a time period where you can revise all your 19 subjects, properly. So even if you give 2 days to any subject, then even it is 38 days, still 12 days will be left. So that's a good time. That's an ample time. Okay. So Wasim, about the anesthesia college and all, let's keep it for another session. You can put it on the Telegram. This is my third attempt. I hope his last FMG exam to clear as well. So absolutely our best wishes to you. Definitely you're going to do that. Okay. So definitely you will be clearing it. Have that focus in your mind. Never have that fear. See, there are two important things. First, not having the fear that I am appearing for the exam. What will happen? Second, don't be overconfident that I am leaving a subject and I'm going to do it. I'm again telling you guys, don't leave any subject. 5 marks and 5 marks. Alfaiz is saying me that I'm planning to leave 2 subjects of 5 marks. Why? Are they not countable in your exams? Don't the student get 149 marks? Don't they fail by 1 mark? So why I'm ready to leave my 2 subjects when you've got like 50 days? How can you say that you are going to leave subjects?
Dr. Sushil, I want to take up this point.
Please.
Because I have seen this people doing it a lot, बच्चे. So देखो, let me just explain you this and probably you will be able to relate to it. देखो, there are 19 subjects. Okay. अब होता क्या है? You have to understand. Whenever you give some time to the subject, you improve very, very quickly. If you give lot of time to a subject, then the improvement does not happen much. एक छोटा सा example लेते हैं. Let us take the example of community medicine. Let us take an example that there will be 25 questions from the community medicine on an upper side. If I tell you, you have not read the community medicine, how many questions you will be able to do? 3 or 4. Let us say that you have read community medicine for 5-7 days. After reading community medicine for 5-7 days, you will be able to do 13-14 questions. If you read community medicine for 1 month, you will be able to do 16-17 questions. If you read community medicine for 3 months, you will be able to do 20 questions. If you read community medicine for 1 year, even then you will be able to do 22-23 questions. यानी कि rule क्या है? Irrespective how much you read, you will never be able to do that subject 100%. But reading it for 5 to 6 days give you a lot of improvement. तो MCQ एग्जाम का रूल होता है कि हमें मास्टर नहीं बनना. We are not supposed to master of 5 subjects. We are supposed to be jack of all 19 subjects. तो हर सब्जेक्ट को थोड़ा सा पढ़ के जाना है, ब्लैंक नहीं छोड़ के जाना. रादर अ शॉर्टर सब्जेक्ट शुड नेवर बी लेफ्ट. एक बड़े सब्जेक्ट में थोड़ा कम टाइम दे दोगे तो चल जाएगा, बट अ शॉर्टर सब्जेक्ट शुड नेवर बी लेफ्ट. अगर डरमा आधे दिन भी पढ़ के चले गए ना, तो 5 में से 4 क्वेश्चन ठीक हो जाएंगे. ये रूल है. अगर फोरेंसिक मेडिसिन हाफ अ डे पढ़ लिया तो 5 में से 4 क्वेश्चन ठीक हो जाएंगे. अगर एनेस्थीसिया हाफ अ डे भी पढ़ लिया तो 5 में से 4 क्वेश्चन ठीक हो जाएंगे. अगर बिना पढ़े करे गए तो 5 में से 0. इसलिए शॉर्ट सब्जेक्ट को कभी भी नहीं छोड़ के जाना. स्टैगर्ड करके टाइम को डिवाइड करना है. 50 दिन में अगर आज की डेट में आप 100 प्लस करेक्ट पर भी बैठे हो ना, 90 प्लस करेक्ट पर भी बैठे हो, तो भी 50 दिन मेहनत करके पढ़ोगे तो 150 तक पहुंच सकते हो. प्रोवाइडेड यू डिसाइड कि इन 50 दिन में पढ़ना है. पुराना क्या हो गया, पहले क्यों नहीं पढ़ा, क्या नहीं पढ़ा, सब छोड़ दो, कोई बात नहीं ना, जो हो गया, जो बीत गया सो बात गई ना. लेट्स नॉट टॉक अबाउट दैट. देयर इज नो पॉइंट क्राइड ऑन दिस स्पिल्ड मिल्क. Focus now, make a schedule, follow this revision test series, write down these GTs, just give this promise to yourself that in these 50 days, I will give my best. And what I have told to PG students also, eat, sleep, read, repeat. Khatam. Eat, sleep, read, repeat. There should be only these three things that should be there in your life for the next 50 days. Eat, sleep, read, repeat. And you are getting 150 plus without a doubt. If you are trying to get something else, that's my best wishes to all of you. That is all from has guided you pretty well. Just following it, and you're gonna see your name. What is written in front of your name is passed. Take care, and I wish you all the best for the exam. Over to you, Dr. Sushil.
Okay, so thank you so much, boss, for those great words. So sir has very clearly said, Dr. Ashwini is also listening to us. So pleasure, sir, you are here with us. So, okay. So Ramya, you will be added, not to worry. Before the test is there at 12 o'clock tomorrow, the test will be opening at 12 p.m. tomorrow in the noon. Okay, and all of you will be like added to the FMG group. We'll add you to the FMG group about your test and all. And if you have got any doubts, you can just put in the group itself and we'll try to get them sorted as soon as possible. Okay. So all the students who are everything will be told to you, not to worry, everything will be told to you. Just click the form, click the link and fill the form, and you will be shared all the details very, very soon. Okay. So I think it's all from our side. The schedule is ready, test paper is ready, test series is ready, and now you all should be ready too. Okay, so best wishes from our side, and for sure you guys, you are going to rock. Have trust in yourself, have faith in yourself, no negativity now. You have been doing fantastically well till now, and this is a time where you should not just go down just because some of the subject was not ready. So definitely you're going to crack it. Just have faith in yourself, stick to the basics, stick to the concept, be consistent. I always tell everyone, if you are just improvising 1% per day, even after 30 days you improvise 30%. After 50 days you'll improve at least 50%. So I think that's going to make a big difference in everybody's life. So just try to improvise yourself 1% per day, and that should be more than good for us. That's what I believe. Okay, so stay hopeful, stay positive, and that's all from my side as well. And for any kind of academic assistance, we are always
and
ready.
Wish you all the best.
All the best, everyone. Thank you so much, boss.
Take care, everyone. Bye. Thank you, boss. Thank you, everyone.